Thank you, Meenakshi. Greetings, everyone. And as Meenakshi has shared, this study, the review and analysis of Rehab 2030, a call for action towards inputs for the World Health Assembly, was commissioned by the Indian Forum for Rehabilitation and Assistive Technology, the Indian Disability Forum, and the National Center for Promotion of Employment of Disabled People. Next slide, please. Yeah. As we all know, the Rehab 2030, a call for action, is the outcome of a two-day workshop held at the WHO headquarters in Geneva in 2017. For your information, it had 208 participants, mostly representatives from developed countries, 67%, and about 16% from Asia and African countries, and the remaining from the Mediterranean and Pacific countries. The group met to discuss the increasing need for rehabilitation and how important it is to meet the Sustainable Development Goals. And this is one of the 10 actions. Call for action is the outcome of that meeting. I'm not going into details of each of the actions, but you can look into the report and later see that. Let's move forward. Suja, next slide. The objective of the review was to look at whether the Rehab 2030 call is fit to meet the needs of persons with disabilities and their families members, particularly those who are living in poverty and in rural communities. Is Rehab 2030 CRPD compliant? Specifically looking at Articles 4, 19, 20, 25, and 26. Thirdly, what important issues would the WHO resolution address to ensure the call for action is CRPD compliant and it meets the needs of the people, particularly living in poverty in rural areas? The methodology used was a desk review of Rehab 2030 minutes and the various related documents. Next slide, please. Yeah. The findings meeting the needs of persons with disabilities living in poverty and rural areas. The Rehab 2030 acknowledges and highlights the need for rehabilitation due to demographic changes, aging population, non-communicable diseases. It considered rehabilitation as an investment across lifespan and an essential component of integrated health services. It promotes the integration of rehabilitation within the health system in countries and introduced rehabilitation guide for the country leaders for integration. It's a very bureaucratic document which actually guides, can be used as a guide by the country leaders on how integration can happen. Rehab 2030 stressed on the need for health financing, health information systems in countries, but most of it was talking about the challenges related to health financing and the health information systems. It highlighted barriers to rehabilitation, particularly lack of policies, lack of infrastructure, workforce, and coordination between ministries, and LMICs, the low and middle income countries, are worst impacted, is what it states. Next slide, please. Yeah. Moving on to the findings, Rehab 2030 uses the International Classification of Functioning definition, which is a good and broad definition. But in this Rehab 2030, it has an emphasis on functioning and health condition of individuals. There is a need to bring the individual and the environment together as is specified in the ICF definition as well as in the UNCRPD definition. But however, throughout the document, you can see the emphasis on functioning and health conditions of individuals, ignoring the environmental and the barriers as stated in UNCRPD. The language used generally is condition-specific organizations, user groups, and not necessarily persons with disabilities. That terminology is appearing only once in the document. Almaty and AASTHA Declaration. The Rehabilitation Guide does not stress on community participation and self-reliance of people in planning, organizing, of primary health care. Community-based rehabilitation promoted since 1978 by WHO should have been part of the call for action, but the guide, it is not part of the call. It is not mentioned also. The guide instead introduces a new terminology, community delivered services, which is not clarified further in the document. Rehab 2030 says that health system should take the stewardship of rehabilitation because it's a health issue and though it has linkages with others, but a collaborative leadership is required as we all know, disability is multidimensional. Habilitation does not find a place in Rehab 2030. Next slide, please. Yeah. Coming to the second question on alignment with UNCRPD, unfortunately or sadly, there is no mention of UNCRPD or any of the articles in the Rehab 2030 documents. Rehab 2030 highlighted global cooperation on assistive technology and hence finds a link to Article 20, which is on personal mobility. There was a session which emphasized on the need for awareness. It was a group session where there was a lot of discussions and suggestions on creating awareness. There's linking with Article 4 on general obligations, but discrimination, rights, and anything which is mentioned very particularly under Article 4 is not mentioned in the document. Article 25, health. Article 19, living independently and being included in the community. Article 26, habilitation and rehabilitation are not recognized under Rehab 2030. It's not mentioned. Next slide, please. Now, the setbacks of Rehab 2030, as the analysis shows, is that there is no buy-in from countries. There was a second meeting of Rehab 2030 held in 2019 in Geneva, which concluded that rehabilitation in health systems is not a political priority of national governments to make it real for people. In fact, they said only 8 countries had partially tried to implement the rehabilitation guide. A call circumventing AASTHA. It does not look at health as a human right or acknowledge the fact that health is not just about functioning, but complete physical, social, and mental well-being as stated in the AASTHA Declaration. UNCRPD is invisible. It's a glaring gap. The UNCRPD is the foundation upon which Rehab 2030 which to be built, but it is left out. Lack of poverty discourse, poverty trap, multidimensional poverty, gender dimensions, the need for children, none of this, it finds no mention in the Rehab 2030. There is absence of discourses or even mention of the previous commitments, as I said earlier, whether it is on AASTHA or AASTHA declarations, but the WHO resolution 58.23 on CDR, 67.7 on disability, the Global Disability Action Plan 2014-21, which was going on when this workshop happened in Geneva. None of this, the WHO framework on disability, all of this are not mentioned in the document. Next slide, please.
Christy, you have a minute.
Yeah. Next slide, please. So the recommendation is that promote human rights and Rehab 2030 should be in full alignment to UNCRPD, should uphold the principles of AASTHA and AASTHA with persons with disabilities at the center. Now, if you look at it, exclusion from governance process, exclusion from their right to take decision on their bodies and on their own health care, all this will lead to inequitable health outcomes. It should build on CDR. CDR has now evolved not only just as an approach towards rehabilitation, the multisectoral approach towards equalization of opportunities and social inclusion of people with disabilities, and increase political commitment and leadership to strengthen health systems for persons with disabilities. These are the recommendations. Thank you very much.
Thanks, Christy.